It's a pleasure to introduce our distinguished speaker, Dr. Julie Gralow. Dr. Julie Gralow is the Medical Officer and Executive Vice President of the American Society of Clinical Oncology, ASCO. Prior to assuming that role, she had a career as a breast medical oncologist and professor of global health for 25 years at the University of Washington in Seattle. Today, Dr. Gralow is going to talk to us about advancing breast cancer research and leadership development in Gaza, collaborations and opportunities. Julie, thank you for doing this. Welcome, and hope to see you next time in Gaza.
Thank you very much, Rola, and welcome to everyone. Thank you for the opportunity for me to discuss breast cancer research and leadership development opportunities and collaborations. I will be focusing a lot on opportunities within ASCO, the American Society of Clinical Oncology, but I'm happy to talk with you about any other collaborations and opportunities if you'd like after the meeting. So I'll give you a little perspective of ASCO. Although we have the word American in our name, we are truly a global organization. Our ASCO membership is 33% international. Our annual meeting attendance this past year was 40% international, and in pre-pandemic years was 50% international. We have more than 45,000 members in over 150 countries. This busy slide shows our strategic plan, and I'll just point out a few things. One, our mission is conquering cancer through research, education, and promotion of the highest quality, equitable patient care. And you see 4 goals of our strategic plan, and goal number 4 is to make a global impact. And we are really committed to this global impact over the past several years, so much so that at our annual board retreat this past March, we focused the whole 2.5 days on making a global impact. And we had 3 major breakout sessions, one on global access to essential treatments, one on international education, and one topic of international leadership development. So with respect to ASCO global engagement, we have engagement across all 3 of our mission pillars: education, research, and quality care. In the area of education, we have something called our IDEA Mentoring International Development and Education Award. I'll tell you a little bit more about that. We have some virtual mentoring programs that have particularly picked up during the pandemic. We have international courses and more being done virtually with the pandemic. We partner with Project ECHO in international education. We hold one major international meeting, and it's called our Breakthrough Meeting. It will be in Yokohama, Japan this next August. We do have a Best of ASCO international meeting. A few years ago, we added a global health track to our annual meeting so that we could have more education sessions related to global health. And we do a lot of global webinars. Now, here are some of our international courses, and I mention these to you because these are opportunities for you to work with ASCO in bringing an international course to Gaza. And I've had some junior faculty members I've worked with in developing these courses. For example, we have a multidisciplinary cancer management course where usually the country or whoever's putting it on picks a couple of different topics. Breast and cervical cancer are common. We have a tumor board development conference where we have a whole conference on how to optimally design and implement tumor boards that are multidisciplinary. We have a palliative care workshop. We have a newer course on cancer prevention and screening for primary care providers where we bring in the local oncology experts, but we also bring in primary care providers in a train-the-trainer type setting to help educate primary care on cancer prevention and screening. And then we have an ASCO International Clinical Research course. we have 10 to 12 courses per year, and you have to apply as a country or an institution, and then we help develop the course with you. And these pictures just show an international course that we held on multidisciplinary tumor board in Kathmandu, Nepal, and another palliative care virtual course that we held in Sarawak, Borneo, Malaysia. We've also worked with ESMO, the European Society of Medical Oncology, on developing recommendations for a global curriculum in medical oncology that's meant to have the basics for what any training program in medical oncology, no matter where in the world is, that should be included. So we started with our first global curriculum in 2004, and we updated it again in 2010 and 2016. And we currently have another update in the works that we hope will be published by the end of this year. 36 countries have adopted this global curriculum in medical oncology as part of their training program. Now, I wanted to talk about some career development opportunities available within ASCO. I've given you the web link to the career development part of our website, and you can see that some of those opportunities include grants and awards, mentorship, leadership development programs, and many other opportunities. I'll go into some detail here. I mentioned this IDEA Award, International Development and Education Award. I think this is a terrific program, and it provides support for early career oncologists in low and middle income countries to come to the ASCO annual meeting. It pays for that trip. It pairs the IDEA recipient with a mentor, and then after the ASCO annual meeting, a visit to that mentor's institution. And it develops long-term relationships, the sharing of knowledge to improve cancer care, with the idea that our IDEA mentees will go back to their countries and help improve cancer care. And our past IDEA recipients are really a pool for our ASCO volunteers. We try to get them on committees. Since 2002, when we developed this program, we've had 405 IDEA recipients from 70 countries. And applications for the ASCO 2023 IDEA Award are due at the end of October. So think about this. If you're an early career oncologist, you should apply for this. And I think it's a wonderful program. I've had 4 ASCO IDEA mentees across the span of my career, and I'm still in regular touch with 3 of the 4 of those mentees, and they have risen to be leaders in their own countries. We also have a virtual mentoring program that was really developed during the course of the pandemic when travel became more restricted. And we have separate virtual mentoring programs for practicing oncologists, populations underrepresented in medicine, women in oncology, and oncologists in training. I looked up the application deadline for next year, and it's not listed yet. Applications for 2022 are currently closed. So stay tuned if you're interested in this possibility as well. We also have leadership development opportunities. Now, these were developed initially with a US focus, but we have had international applicants and participants in these programs more and more with our global focus. So our ASCO Leadership Development Program is a year-long program where young leaders in the making can network with and receive mentorship from ASCO leadership. And the application deadline is just passed for this year's ASCO Leadership Development Program, but you can look for it next year. We also have an ASCO Education Scholars Program for those who want education to be a part of their career. It's also a year-long program, and the application deadline for this is November 22nd of this year. And then if you're interested in being involved in the editorial aspect of oncology, we have an ASCO Journals Editorial Fellowship, and this is designed for fellows in training or junior faculty no more than 1 year out of training And it gives you an opportunity to learn how to do peer review and editing, and to actually write medical research manuscripts. So applications for this past year were due in February, but we expect another round next year. Also, if you come to our annual meeting, I just want to point out that we have some great networking lounges. We have a trainee and early career lounge for students, residents, fellows, practicing oncologists within 5 years of finishing their training. And at this networking lounge, you have one-on-one mentoring meetings, panel sessions, roundtable discussions, and you have access to free printing and some drinks and light snacks. We have a women's networking center for women of all training levels. And again, in this networking center, we have one-on-one mentoring sessions, panel sessions, and roundtables. And we have a publications lounge for authors, editorial board members, and reviewers. It's not restricted at all to the level of your career. And there are informal sessions for authors and one-on-one mentoring opportunities here too. Now, within global engagement and the research mission pillar, we have international research courses. I've already mentioned that, but we also have funding, international innovation grants. We have a specific Young Investigator Award in global oncology. We have a Life Award, a long-term international development award. And with respect to dissemination of global research, we have a relatively new journal called JCO Global Oncology. Through our Conquer Cancer Foundation, we have a lot of grants and awards, and some with an international focus. This picture shows all of the recipients of our Conquer Cancer Awards in 2022. The stage is full, and many of our recipients were actually not able to attend. They were virtual, so it was an even bigger pool. We have, as I've already talked about, our IDEA Award. We have our Young Investigator Award, Career Development Awards, International Innovation Grant, Long-Term International Fellowship, and we have an International Women Who Conquer Cancer Mentorship Award. And these are excellent opportunities. Now, the Young Investigator Award is intended for applicants from any country. The application deadline for this just passed, but think about it for next year. The YIA provides funding to promising young investigators to encourage and promote quality research in clinical oncology. It's a one-year award of $50,000. And this past year, we were able to fund all of the applications that were deemed to be competitive as they were reviewed. And so we really are giving out a lot of these awards. And we've even created a separate category called our Global Oncology Young Investigator Award that is restricted to those who are doing global oncology research. So you even have an advantage here. We also have a Career Development Award. Again, this is open to applicants of any country. It's more toward middle-level clinical investigators. They have to have received an initial faculty appointment, and it's a 3-year grant, so a little bit more funding. And the application for this is October 20th of 2022. Here you see the website address to look up these awards. Internationally, we have our International Innovation Grant. The deadline for this will be in December, although the LOI in theory was supposed to have already been received. It provides research funding in support of novel and innovative projects that can have a significant impact on cancer control in low and middle income countries. And it's a 1-year, $20,000 grant. We have a long-term international fellowship. The deadline for this isn't until January. It provides early career oncologists in low and middle income countries support and resources to advance their training by deepening their relationship with a mentor at a host institution in the US, Canada, or Europe. It's 1 year, $115,000. It provides travel as well with that mentorship. And then we have an International Women Who Conquer Cancer Mentorship Award. Nominations for 2023 are now open, and this is to recognize extraordinary women leaders in oncology who are role models and have excelled as a mentor. and demonstrated a commitment to the professional development and of women colleagues as clinicians, educators, and researchers in oncology. So if you know of anybody who you want to nominate, please do so. We're always looking for nominations for this International Women Who Conquer Cancer Award. I told you about JCO Global Oncology. We created this journal to fulfill the growing need for high quality literature on challenges that healthcare professionals in research-constrained settings face in conducting research and caring for patients with cancer. Gilberto Lopez is the editor. He's very, very accessible and reachable, and I'd encourage you to submit your research and even consider maybe being an editor. We have junior editor positions for JCO Global Oncology. With respect to global engagement under our quality pillar, we have our International Quality Oncology Practice Initiative program, quality training programs, resource stratified guidelines, international cancer core sites, and we participate in the CCAN City Cancer Challenge. With respect to our quality initiatives, we have our Quality Oncology Practice Initiative, our Quality Training Program, and our Quality Care Symposium held annually. With respect to international quality training and practice initiatives, this is something that is fun for a practice group to pull together physician-led oncology teams. You can apply to participate in either a one-day or a 6-month quality training program as a group, as a team, and you have to have a goal for what kind of quality improvement you want. Since 2016, we've had 268 international participants in our quality training programs across 9 countries. And then we have our COPI program, our Quality Oncology Practice Initiative, which is a practice comes in and meets certain criteria for quality through self-examination and improvement. And we've had 709 physicians currently active in COPI International and are looking to have more partners in developing quality in practice. Here's an example. We're doing a COPI low and middle income quality pilot in a few countries in Honduras, Uganda, Malaysia, and have a site that we're picking in Bolivia. And this is taking quality measurement and reporting and modifying it to the given country and practice setting, looking for gaps, and then starting on the pathway to quality improvement. This is Dr. Jackson Oram, the director of the Uganda Cancer Institute, who's been a leader in Uganda in their COPI low and middle income pilot. And you can see here that at their site in Uganda, they picked 5 core measures to just establish a baseline and then work on quality improvement on. And that's having a pathology report confirming malignancy, staging documented within 1 month of the first office visit, documented plans for chemotherapy, including doses, route, and time intervals, having the number of chemo cycles documented, and then having pain assessed by the second office visit. We've also taken some of our standard guidelines and worked with our international partners and members on creating resource stratified guidelines that are evidence-based and culturally appropriate. We've published cervical cancer guidelines, palliative care guidelines, colorectal care guidelines, ovarian cancer guidelines, and are about to publish a metastatic breast cancer guideline. We're increasingly engaging with oncologists around the world through our International Affairs Committee and our International Regional Councils. And these regional councils we've established first in Asia Pacific, then in Latin America, most recently in Sub-Saharan Africa, just launched a few weeks ago. Our Central and Eastern European Regional Council is on hold due to the war in Ukraine. And we're starting to talk about perhaps our next regional council will be in MENA. So if you're interested in this, stay tuned. There are many ways to volunteer within ASCO, and this just shows the web link for how you can become a volunteer at ASCO. You need to nominate yourself, and many ASCO committees have international members. So in conclusion, We have many opportunities for collaboration and opportunity in advancing breast cancer research and leadership development. And we'd love to partner with those of you in Gaza. Let's work together to achieve equitable cancer care for all. Thank you. Thank you so much, Rola. This is just a terrific, amazing event. I'm thrilled to have given the keynote on breast cancer care and control across the continuum, strategies for optimizing outcomes. It is so important to work together as a multidisciplinary team. Teamwork is how we're going to get the best outcomes for our patients. And we have lots of opportunities to promote collaboration and some innovative delivery of cancer care. So I'm thrilled to see how very multidisciplinary this conference is. Additionally, you've had some amazing pre-conference events. I was thrilled to be invited to speak on advancing breast cancer research and leadership development in Gaza, promoting collaborations and opportunities, many of them with ASCO, but that again, collaborating and teamwork and partnerships are how we're really going to improve cancer care in Gaza as well as across the globe. Thank you so much for the opportunity to participate and for this important work that you're doing.